So I just wanted to briefly thank the organisers for inviting us to give this talk. It's been a real privilege to be part of the CDC task force on this very important infection. It's such a great group of people. And to pay a real tribute to Janelle and all her great colleagues at the CDC who've really led this, this effort beautifully, I think. We're going to look at the population level using some preliminary analyses of AFM and enterovirus D68 data to see if we can project forward, understand the dynamics, and see if we can project forward tentatively what's probably going to happen next. Daniel did all this work, so I'm going to hand over to him.
Hello, thank you again for inviting us for the talk. So today we're going to be talking about the effect of social distancing that's been put into place due to the COVID-19 pandemic on the dynamics of enterovirus D68 and D68. And in order to answer this question, first we're going to present our work on capturing the spatio-temporal dynamics of enterovirus D68 at the population level, and then we're going to try to relate the enterovirus D68 patterns with the AFM patterns that we saw earlier in the biennial patterns, and then we're going to try to explain what the drivers behind the biennial patterns of enterovirus D68 using mathematical models, and then we're going to try to project forward to understand the potential impact of COVID-19 pandemic on enterovirus D68 dynamics. In order to answer these questions, we're going to build off from earlier work from our collaborator, Marga, where she was able to analyze non-polio enteroviruses and polio enteroviruses data from the US, and then found that the dynamics of enteroviruses at the population level is correlated with climatic variables. In particular, there's a clear latitudinal gradient in seasonality, where northern states are more likely to get later peaks, and then southern states are more likely to get earlier epidemics. And then we're also building off from her more recent work on looking at enterovirus dynamics in Japan, where a simple SIR model where people get infected, so that people get infected and then develop lifelong immunity, can explain the dynamics of complex enterovirus dynamics in Japan. In particular, you can see that some of these viruses, such as Coxsackie virus A2 or Coxsackie virus A4, exhibit similar biennial patterns, and the model can explain these dynamics. So in order to understand the patterns of enterovirus D68 circulation, we rely on biofire data. Currently, the enterovirus surveillance in the US relies on passive surveillance, but biofire, as Kevin mentioned earlier, is a commercial testing kit that's distributed through institutions, and it allows us to capture more granular dynamics at the spatial and temporal scales of enterovirus dynamics. And then the respiratory panel results are the pathogen extended resolution algorithm is used to predict enterovirus D68 cases from the clinical samples that have been tested for rhinovirus and enteroviruses. So we're going to be analyzing these predicted results. And so in the US, in panel A, we present the time series of enterovirus D68, proportion of enterovirus D68 cases that in the US and in some of the states. Here we present some of the aggregate results from aggregate states due to privacy concerns. In the US, there's a very clear biennial patterns of circulation, and so in the New York, but in some other states, we don't see the biennial pattern. For example, in the Ohio, we're missing an epidemic in 2016. And so there's some, even though there's a clear biennial pattern, at the national level, there's geographical variation in the patterns of circulation at the state level. And then we characterize the timing of cases that's shown in heat map in B, and then also as XY plots in C and D. And then overall, we see that there's a clear latitudinal gradient as consistent with earlier work by Marga on other non-polio enteroviruses, that southern states are more likely to have epidemics earlier and northern states are more likely to have epidemics later in the year. Then we use this data and then try to correlate with the AFM data. So in figure A, the red lines show the AFM data from the CDC that was presented earlier. And as we can see, as is mentioned in earlier talks by Janelle and Dr. Chu, that in 2018, we see a much larger AFM cases, which are partly contributed by EVA71 related AFM cases. But on the other hand, enterovirus dynamics look fairly stable, that that the size of an outbreak doesn't change very much over time, but the overall timing of epidemic is strikingly similar. In particular, we also, B shows a cross correlation plot where we find that there's a 1 month lag between the enterovirus epidemic and AFM epidemic, although these are likely to be driven by potentially some much shorter lags, but we can't detect it because we're analyzing data at the monthly scale here, and also potentially some geographical differences in AFM surveillance and EVD68 surveillance that we get from BioFire data. And then on D, so we try to measure the correlation between the number of EVD68 cases and number of AFM cases, and overall in many states we find a strong positive correlation. And then to further test this correlation, we use a linear mixed model in E, shown in E, and overall we find a significant positive correlation between the EVD68 cases and AFM cases across time, which provides sort of indirect population level evidence for their causality. And then even at a finer scale, for example, here in New York and Utah, we also see that the timing of AFM cases and enterovirus D68 cases roughly match. Then we try to explain what's driving these. We try to answer whether we can explain the geographical variation in the dynamics of enterovirus D68. So we use what we call SIR model that Margo used earlier on. And essentially what we show here is that the lifelong immunity can explain the enterovirus dynamics sufficiently. And then although predicting enterovirus outbreaks is not easy, since we're looking at a very short time series, when we include more data to our analysis, we show that we are able to, in fact, capture sort of more irregular, longer-term dynamics. And we also use simulations to try to understand whether these biennial patterns are stable, and our analysis suggests that the biennial patterns that we observe may not be stable. So using these model fits, we want to try to predict what's going to happen in 2020 with COVID pandemic. And if you look at data from other countries, we've already started to see decline in enterovirus D68 cases. Especially if you look at Taiwan, it's very clear that the number of AFM cases that's being reported recently is much lower than the historical values. Less extreme in South Korea and Hong Kong, but we still see a decrease. And in the US, we don't have enterovirus data for 2020, but we can look at other diseases. For example, here's data on RSV, so here the vertical red line is when the national emergency was announced. And as soon after the emergency was announced, we see that there's a very clear decline in the laboratory surveillance result for RSV, and then also the same results hold for influenza. Again, that, for example, in the left side, as soon as in 2020, the white dashed lines again represent when the national emergency was announced, and the prevalence of influenza drops near zero immediately, and then also panel B shows the same. results, just summarized at a different time scale. These prevalences are much lower than historical values. So now it's fairly clear that social distancing are affecting circulations of other viruses, and we're interested in understanding how it's going to affect the circulation of enterovirus D68 in 2020. Since there's a lot of uncertainty in the basic reproduction number or R naught of enterovirus D68, we simulate the model across a wide range of parameters and then find that under normal conditions, so panel B, that we predict that a major enterovirus D68 outbreak is likely, even though the biennial cycle may be unstable. So major enterovirus D68 outbreak, possibly AFM outbreak, would be possible under normal conditions, but if there's any decrease in contact rate, then we're unlikely to see an outbreak this year, even with the modest amount of decrease of slightly more than 10%. So in conclusion, we find that there's a strong spatiotemporal correlation between EVD68 cases and AFM cases, which provides a population level support for their causality, which we haven't been able to actually characterize earlier, but now we're able to do that with novel surveillance data through BioFire. Then we can predict that even though recent biennial patterns observed in enterovirus D68 outbreaks may be unstable, we tentatively predict a major outbreak in 2020 under normal conditions. And finally, the key point is that if a decrease in contact rate due to social distancing prevents an outbreak from happening this year, then susceptibility at the population level is going to build up, and we might expect a larger outbreak in later years, which we didn't explore, but we're currently exploring for other viruses, and it's quite likely that we're going to get a larger outbreak in the future. And then finally, I just want to thank all our collaborators of this work, as well as the CDC AFM Task Force and colleagues at CDC, and also New York Department of Health, Colorado Department of Health, and Kirsten St. George, who provided the data for this work. And I would also like to thank Bryan, advisor, who advised me for this work. And thank you.